Hey everyone, my name is Jennifer Bell and I am a Medicare licensed insurance agent, and I think that one of the most confusing things in this world is Medicare, which is ridiculous because all of us are going to have to face it one time or another, right? But I do think the best way to really attack Medicare is to break it up into the parts that it's already broken up into. And so today in this video, we're going to talk about what is Medicare Part A. So Medicare Part A is that thing you see being deducted from your paycheck every time you're working. When you pull your paycheck stub and you see Medicare as a deduction, generally speaking, that's going to Medicare Part A. And the reason I say that is because when you finally do go on Medicare, Part A is free. Well, in a sense, because you've already paid for it. And that's what you'll see on your paycheck. Now, the way Medicare Part A works is it covers your inpatient hospital stays. Now, the way I remember it is Part A, the letter A, is shaped like a roof. And so whenever you're inside the roof as an inpatient, then that's when Medicare Part A is going to be kicking in. So inpatient hospital stays, or if you transition to a skilled nursing facility. So the way I look at that is, let's say you have a back surgery or a hip replacement, a car accident, anything that's going to put you into an injury status where you're not necessarily sick, you're just injured. They want to get you out of the hospital where sick people are and put you into a rehabilitation center. And that would be what you would call a skilled nursing facility. Now, there's a couple of ways that you can qualify for Medicare Part A. The first is if you yourself have worked for 40 quarters in the United States. The second is if you have a spouse who has worked for 40 quarters in the United States, you can claim on their benefit. And the third is if you have a disability and you get on Medicare because of a parent. Now, that's something that you would have to talk to Social Security about. I don't know all the ins and outs of that, but it's definitely an option for you. Now, Medicare Part A is just one piece to the puzzle, and so there's a few different things that you need to know about it and how it works. For example, if you were to go into the emergency room and get held for observation, so you're not technically an inpatient, you're just observation, that is not Medicare Part A. The other tricky thing, and can also have a relation to being held for observation, is being transferred to a skilled nursing facility. Now, the reason why this is tricky is with Medicare, you have to be an inpatient in the hospital for 3 days and then transition to a skilled nursing facility. As long as you have been an inpatient for 3 days, your skilled nursing facility stay will be covered. Now, if you were admitted through the emergency room, held for observation for one 24-hour period, and then you were admitted for 2 more days, you, as the patient, would feel like you'd been there for 3 days, but on paper and coding, you'd really only been an inpatient for 2. So it's really good to be an advocate for yourself and know whether or not you were held for observation or if the whole time you were there, you were an inpatient in the hospital. Now, there are obviously some costs to Medicare Part A, and I'm going to go into that in my next video. But what I want you to make sure that you're aware of is Medicare Part A is what you pay into while you're working. If you decide to go on to Medicare while you're still working, you will still be paying into Medicare as long as you're getting some sort of a paycheck. And it is something that's given to you at no additional cost. Now, one thing to just kind of be aware of is if you are working and your employer has a plan that you are on, so you're actively working, receiving employee health benefits, you don't have to take out Medicare at all. A lot of people will take Part A because it's free, but you don't even need to do that. So that's completely your decision, totally up to you. I'm also going to go into employee coverage and Medicare in another video, so definitely stay tuned for that. If you have any questions, please do not hesitate to reach out to me via email. Just know I am a Colorado licensed insurance agent, and I'm happy to help you here. And eventually, hopefully, we'll get licensed in other states, Texas as well, actually, Colorado and Texas, but I'm a Colorado resident. If you have any questions, please don't hesitate to reach out to me. I'm happy to help. Thank you so much for taking the time to watch this video. Until next time, have a great day.